Hello, my name is David Neal. I'm a Maria Sklodowska-Curie Early Stage Research Fellow based in the Department of Psychiatry at the Amsterdam University Medical Centers. People with dementia, now more than ever, are at risk of social isolation. And I'm here to tell you today about FindMyApps, which is a feasible intervention to improve social health in early stage dementia. FindMyApps was designed to help people with early stage dementia learn to use tablet computers. Specifically, it helps people find apps that meet their needs and interests and help them to engage in social and meaningful activities. So first, I'd like to tell you a little bit about what FindMyApps is. It consists of three components. The first is an app library containing apps that have been assessed against criteria in the published literature as being, in general, user-friendly for people with dementia. Second, there's a selection tool, so that's an app on the tablet that allows the user to browse the app library on the basis of a personalized preference profile. And finally, there's a training session. Now, FindMyApps is a dyadic intervention, so for the person with dementia, this covers the basic functions of the tablet and how to use it, and for their informal caregiver, it covers the pedagogical technique known as the errorless learning method. So that helps them to support the person with dementia in learning how to use the intervention. So that's what FindMyApps is. Now I'd like to tell you a little bit about how we tested feasibility and what the results were. So our group carried out two consecutive pilot randomized controlled trials and parallel process evaluations. These were set up according to all the relevant Medical Research Council guidance. We used validated instruments to assess social participation and self-management at baseline, again at 3 months. And we also conducted post-test semi-structured interviews with a purposively selected sample of participants, and that was to support the process evaluation. The semi-structured interviews were analyzed using thematic analysis. Their themes were the context, implementation, and mechanisms of impact of the intervention. What we discovered was that actually the training component of the intervention was inconsistently implemented between dyads. However, we also found that most participants in both studies learned to use the intervention and were using apps regularly. Regarding the research method, we also discovered that many participants found the interviews too long. Now, dropout rates for the two studies were 37.5% and 12.1% respectively. As these were pilot studies, they had small sample sizes. So as we expected, most outcome measures revealed no statistically significant differences between groups. However, we took account of the effect sizes to inform sample size and power calculations for a subsequent definitive randomized controlled trial. And effects ranged from small improvements favoring the control group on the investing subscale of our self-management instrument to moderately large improvements in favor of the intervention group on the multifunctionality subscale of self-management. So let me finish off by briefly discussing our next steps. On the basis of what we learned from the process evaluation, we've refined both the intervention and the research method. So we hope to implement the training more consistently in a definitive trial. And we've removed a couple of instruments to reduce the burden on participants of taking part in the research. We recently started a definitive randomized controlled trial in the Netherlands. So we aim to recruit 150 community-dwelling dyads for the study in the Netherlands. And the primary outcomes, again, will be social participation and self-management of people with dementia and a sense of self-competence of the caregivers that take part. So thank you for your attention. If you'd like to get in touch to discuss either supporting the trial in the Netherlands or possibly translating the intervention to your own country, my contact details are on the screen. So I'd like to finally round off by pointing you to the published literature on which this presentation is based, and to acknowledge the generous funding that we've received from both the EU and local funders in the Netherlands that have made this work possible, and also to thank other partners involved in the project.